Good day everyone, I am Trisha Pang from Our Lady of Fatima University. I am from BSN 1 M2-A. Today we'll be conducting a return demonstration for bed bath, shampooing, oral care, and back massage. So, before we start with the procedure, I must review the patient's medical record first to check if there is any limitations to his physical activity. Then next, I will prepare the materials needed for the procedure. And then next is, I will perform hand hygiene and wear my gloves. So, by wearing the gloves and performing hand hygiene, we'll able to prevent the spread of microorganisms. After that, I will check the ID band of the patient. Okay, sir, check ko lang yung ID band niya. Okay, thank you. And then, next, I will close the curtains for privacy. And then next, I will now place a towel on the back of the head of the patient and to his chest area. Okay, so, hello po, sir. I will place a towel po in your back of the head. So, is it okay po if I raise it po? Thank you po. And then to his chest. Okay, so done. Next is I will put a towel in the water. And then I will wash the patient's face. So first, I'll proceed to his eyes first. And then next, I will rinse it again po. Now, I will wash his forehead, cheeks, ear, and neck. So first, in this part of his forehead, and then to his face, to the other side of the face, ear, chin, and neck. Okay, so done. Next is, I will pat dry the patient's face. So next, I will now wash the patient's arm. So I will move the towel onto underneath his arm. And then I will wash again the towel. So first, sir, I will wash your arm po. So first to his hands. And then forearm, and then arm, and to his armpit po. I will pat dry it. Okay. So assume that I already cleaned the other side of his arm because I can't go to the other side. So assume that I already cleaned it. But in a clinical setting, we must clean the other side too. Okay, then next, let's move forward to the patient's leg. Okay, so, sir, I will just expose the leg po. And then place a towel underneath his leg. Okay po, thank you. I will wash again a towel. And then pat dry it with the towel underneath his feet. And then I will cover the leg to maintain privacy. Okay, so of course the purpose of this bed bath is to keep the patient's body clean and provide comfortness to his body. And then next, the chest area must also be cleaned, but however, the patient requested that I shouldn't expose his chest and abdomen area, so we must respect it. So when cleaning the patient's chest area, we must also place a towel here on his chest area and to his abdomen and to his and then perineal area. So assume that I already cleaned it. Next, let's move on to the shampooing of the patient. So first, I will place a towel underneath the patient head. So sir, can you please raise your head po? Thank you. And then, I don't have any shampoo tray here, but assume that I already placed a shampoo tray underneath the patient head. And then next, I will get a drainage so that the water will flow down here. And then I will place a towel onto the eyes of the patient so that the water will not go to the patient's eyes. And then I will get the pitcher and wash my patient hair. Okay, done. Next, I will get a shampoo. And then put it in my patient hair and massage it. So the purpose of this shampooing is to maintain the cleanliness of the patient's hair and his scalp and provide relaxation to his head. And then done. Next, I will rinse the shampoo out of his hair using the pitcher. After that, I will remove the towel onto the patient eye and then dry his hair completely. After that, I will remove it. Okay, sir, please raise your head. So, of course, after the shampooing, assume that the patient must be comfortable to his position and assume that my patient is already dressed in a comfortable manner. Now, let's move forward to the oral care for the patient. So, I will now prepare the materials needed. We have water in a cup, a basin, toothbrush, toothpaste, alcohol, and gloves. So, I will now assist the patient to sit. Sir, can you please sit po? Thank you. And then I will now sanitize my hand and wear my gloves. So the purpose of this step is to avoid the spread of microorganisms and the cross-contamination. And then next, I will give the basin to the patient. So, sir, can you please hold this for me? Thank you. And then, give the water to him. Sir, can you please drink it and spit it after? Okay, thank you. Then next, let's I will be putting toothpaste to the toothbrush. And then I will brush the patient's teeth. So please say it is important that we shouldn't forget the patient tongue, because the purpose of that is to prevent the halitosis or the bad breath. So please, I will now wash the patient tongue. And then after that, I will ask the patient to gargle the water again and then spit it out. Okay, thank you. And then after that, I will get the materials. Lastly, we shouldn't forget to floss the teeth of the patient. This is to prevent the this is to remove the excess plaques to the patient teeth. So assume that I am flossing the teeth of my patient because I don't have any available floss. Okay. Next, let's move forward to the back massaging the patient. So first, I will place the patient in a lateral position. So hello sir, I will just massage your back. Can you please position? I will assist you to position in a lateral. Thank you. And then next is I will lift the patient cloth and expose the area that is needed only to be massaged. After that, I will perform hand hygiene. And then I will wear my gloves to prevent the spread of microorganisms. Next, I will use a lotion or a lubricant to start massaging. And I will spread it all over my palm. And then I am now start to give the patient a massage. So the purpose of this is to provide a good blood circulation all over the patient body, and of course to provide comfortness. Okay, so we're done. And then after that, I will be putting the cloth of the patient back. And then I will assist the patient to place in a comfortable position. So sir, can you now okay, that's it. So after all of those procedures, we must remove, of course, the PPE. And it is important to give a bed bath to the patient to help the patient clean themselves, because some patients cannot move to themselves properly. And then the shampoo, it is also important because it helps the patient to have their scalp clean, and their hair. And then the oral care is to remove any plaques in the patient's teeth, and flossing also helps to remove excess plaque, and then brushing the tongue is to prevent the halitosis and bad breath. And then lastly, the back massage is to help the patient to relieve his pain, to have a good circulation of blood, and lastly to provide comfort.